joining Health Affairs This Week. I'm Vabren Watts.
And I'm Ryann Tanap.
So you'll be hearing from the health equity team more this year. We will try our best to give you stories that really have a health equity spin onto it. And I would just like to say, Happy New Year, because this is the first time that you have heard my voice this new year. And Ryan, I will say over the past month, even though last month was another year, it all seems like the same because we've been really busy within the health equity department here at Health Affairs.
Yes, we have. I don't think there
Yes.
was a down season for us.
No, it was not. Like I would definitely say, it seems like November, December was like some of the busiest months. I know, like Ron, you were getting ready, to plan out everything for the 2023 year and what we're going to do, and then we really just closed out the year with our Health Equity Fellowship for trainees. We did have a session which included attorney Daniel Dawes, who really spoke to our fellows about, being a health equity researcher and then just the history of structural racism within the U.S.
Right. And we also had a session with Courtney McClooney, who talked to us about rest as a means for resistance and
Yes.
in our work in diversity, equity, inclusion, and health equity in particular.
Yes, and that is needed, like that whole rest and recovery, and like you said, rest as a mean of resistance. So make sure for 2023, if you have not made out your New Year's resolution, really incorporate taking time to rest in there. It will definitely benefit you. So Ryan, this week we have to talk about something that happened this week.
Yeah. So last Friday, the FDA approved a new Alzheimer's drug called lecanemab, which will be sold as Leqembi. It was actually approved through an accelerated approval process. And according to the trials conducted by the developers, the drug actually slows cognitive decline in patients in the early stages of Alzheimer's. And I mean, you and I have noticed this treatment has been getting a lot of news buzz. Why is that?
So, interestingly, so when I first heard this, I was actually on the treadmill at the gym Monday morning. That's when it actually came out, but it was actually, accelerated on Friday, as you said. So, in a previous life, when I was a science journalist full time, I used to report on a lot of clinical trials for Alzheimer's drugs. Let's just say that over the past 2 decades, research and development for Alzheimer's drugs have had a 99.6% failure rate. I mean, some organizations and some news media outlets just really just round that up to 100. So I remember, when I used to, start, tracking these drugs and their development, it would take like a few months to a year, and then all of a sudden the trials were halted. The outcomes were not there, as it relates to these drugs that was probably over the past 8 years. Those outcomes did not really advance the field of Alzheimer's treatment.
So now that this new drug has made it through an accelerated approval process, it's really, would you say, encouraging?
Uh, yes and no. I mean, it made it through the accelerated approval process, but yet it's still not fully approved by the FDA. And so, some people, may not know what the accelerated approval process is.
So the accelerated approval pathway, it actually allows for drugs that address serious conditions that also fill an unmet medical need to be approved based on a surrogate endpoint. And in this case, the surrogate endpoint is I believe it's called a beta amyloid plaque.
You know what? That is correct. Yeah, they've really been looking at how beta amyloid plaques really impact Alzheimer's. It is hallmark to Alzheimer's disease, and like they have been creating drug after drugs, really looking at beta amyloid plaques and a few other hallmark biomarkers for Alzheimer's disease. But this is one that has really been in the forefront. So with the new drug. Lecanemab, the drug is given as a monoclonal antibody infusion every 2 weeks. And just so everyone know that the new drug lecanemab is not a cure.
Right. It's not a cure, but it may give those with Alzheimer's more time with loved ones. I also read that the drug won't be widely available anytime soon.
Yeah, so the drug actually comes out in like 2 weeks. It's supposed to come out the week of the 23rd. And but however, Ivan Chong, who is the U.S. chairman and CEO of ISI, said that the expected cost for the drug is 25,000 a year per patient. That is quite pricey. And then to add to that, as of April 2022, the Centers for Medicare and Medicaid Services, or CMS as we know it, they do not allow coverage of FDA approved treatments for target amyloid in the brain. The only exception is if an individual is enrolled in an approved clinical trial.
Isn't Alzheimer's one of the leading causes of death for older adults?
Exactly. The CDC says that Alzheimer's is the fifth leading cause of death for adults 65 and older in the U.S., and it is the seventh leading cause of deaths for all adults. An estimated 6.5 million Americans over 65 live with Alzheimer's disease. In other words, 1 in 9 million Americans over 65 has the disease in the US. And of those 6.5 million, around 1 million have early stage Alzheimer's.
So, what about historically marginalized populations? How does this impact them?
So, Black Americans and those who are part of the Hispanic Latino community have the highest rates of Alzheimer's disease and other dementias. And when or if individuals from these populations get diagnosed, it's usually at the later stages of the disease. So, when it comes to this new drug that is coming out that is really looking at early onset and does not reverse brain damage or memory loss, it sort of makes you wonder if inequities will arise as it relates to which populations will receive it or who would be more, prominent to, to receive this drug treatment. This is on top of a recent Alzheimer's Association report stating 1/3 of Black Americans and 1/5 of Hispanics, as well as Asian Americans, perceive discrimination as a potential barrier for accessing Alzheimer's care.
So, I want to emphasize that point, babe. This is the case for healthcare across the board. There really is a cultural lack of trust in the healthcare system, especially among historically marginalized populations, like you just listed. That distrust stems from structural racism, which is rooted in many of the systems throughout our country, really.
Right. You know what? This was outlined in February 22 issue Racism and Health. That was one of Health Affairs like popular issues. And whether if the racism stems from experience with discrimination while navigating complex health settings, low personal health literacy rate, transportation barriers, or socioeconomic status, there are many factors that may prevent access to care, particularly among marginalized populations. One of the things that, Ryan, that you're working on is really, as I sort of mentioned, like the low health literacy rates. And I know that you're, providing programs and like education to really try to increase health literacy. And I know you also talked about what personal health literacy plans and organizational health literacy plans.
Right. There's a lot to dig in there, but there's definitely a lot of factors I think we need to keep in mind when we're advancing health equity and particularly as it relates to this new drug. I wanted to emphasize, that concern you had, like who is going to have access to.
Exactly.
So before we wrap up this episode, we hope that you all have a restful Martin Luther King Jr. Day, which is next Monday, the 16th. And we're also honoring National Day of Racial Healing on the 17th. It happens every year on the Tuesday following MLK Day, and it's a time to come together, inspire collective action, and create a more just and equitable world, which I think really speaks to the work that we do, babe.
Oh, yes, exactly. So, we would just like to say thanks for listening to another episode of Health Affairs this week. If you like the podcast, tell a friend, leave a review, or subscribe wherever you listen to your podcast. I'm Vabren Watts.
And I'm Ryan Tanap.
Goodbye.
Bye.